Hello, I'd like to welcome everybody to another episode of Coffee, Kids, and Sports Medicine. Today I have the privilege of introducing Dr. Jacob Jones. Dr. Jones is a sports medicine physician here at Scottish Rite for Children. After completing his residency here at UT Southwestern, he completed a pediatric sports medicine fellowship as well as a one-year fellowship in musculoskeletal ultrasound at Boston Children's. Dr. Jones is board certified in pediatrics and sports medicine with an additional certification in musculoskeletal ultrasound, which is now more than ever being applied in new and exciting ways to help diagnose and treat musculoskeletal conditions. He is the perfect person to discuss today's topic, and we are very excited to have him as part of our team here at Scottish Rite. I'll go ahead and turn it over to Dr. Jones today.
Well, thank you, Jared, for that introduction. Let's jump right in talking about ultrasound and pediatric sports medicine. I have no disclosures relevant to this talk. So here's what we're going to talk about today. We're going to talk about some of the basic ultrasound principles and indications for use. We'll just talk briefly about that. We're also going to go over some examples to show how ultrasound is used in sports-related injuries. And then we'll also talk about the advantages as well as the disadvantages of choosing ultrasound as a diagnostic tool in sports medicine. And then at the end, we'll talk just a little bit about using ultrasound to help with ultrasound-guided interventions. So here's just a schematic about how ultrasound works. You can see the probe there at the top right. And what the probe does is it both emits the sound waves and receives them back. So it will emit a sound wave, and when that sound wave comes across a medium, whether that's muscle or fat or bone, some or all of those sound waves are going to come back to the probe. We can see what happens as it interacts with medium 1. Some of those sound waves, indicated by the green arrow, will come back to the probe, whereas some of the sound waves, indicated by the light blue arrow, will proceed through the second medium. And what the ultrasound probe does is it will see the strength of those sound waves and the time that it took for those sound waves to come back. And as it sees those, what it will do is it will convert those sound waves through something called the piezoelectric effect. That's just a really fancy physics term of what it does. And it will then translate those into a grayscale image, which is what we will see on the screen. So what we use is we have different ultrasound probes, okay? There's a wide variety of different ones. In sports medicine ultrasound, we kind of stick to just two different ones. This first one we see here is a linear probe. You can see there that the end of it is flat. The top one is a high-frequency linear probe. You can see it's a little bit wider, which is a common one we use, whereas the one below it, we call that one the hockey stick probe. And you can see how that hockey stick probe is a little bit smaller, which is nice for when we're trying to get around curved structures around the ankle or in the wrist. These linear probes are nice because they minimize something called anisotropy, which we'll talk about that later. But they're really good for seeing superficial structures. Some of the limitations is because it's a flat surface, you have a very limited view. Whereas this other probe we see, you see how the end there has a curved end, and so it can have kind of a phase or a fan shape array of sound waves that it emits. And so therefore, on your screen, you actually have a wider field of view. The other benefit of this curvilinear probe that we see here is it's used more for deeper structures, okay? So the sound waves are lower frequency, which means it can see things deeper, but the trade-off on that, as opposed to the linear probe, is that you don't have as great detail on those deeper structures, all right? So those are the main ones we stick to. We have the linear probe, which sees more superficial structures, which you can get more detail, and the curvilinear, which you can see deeper structures, but you lose detail on those. So let's talk a little bit about some of the uses of ultrasound and some of the things that it can see and maybe what it can't see as well. So for diagnostic purposes, you can see tendons pretty well. So you can evaluate for tendinopathy, you can evaluate for strains. If there's a tendon tear, You can see all of those pretty well with an ultrasound. How about muscles? Muscles you can see pretty well as well. You see strains, you see contusions. Also, if there's muscle tears, you can see those with ultrasound. Nerves. A lot of the nerves you can follow along, and if you're concerned that, hey, this nerve may be entrapped at a certain location, you can just follow the nerve down a limb and you can see if it's possibly entrapped or not. Also, ligaments. Some of the ligaments around the body, especially those that are not inside the joint, but maybe outside of a joint, you can see if there's an injury, such as a sprain to those ligaments. And then joints. You are somewhat limited in joints and what you can see in the joints, but one thing that you can see fairly easily is if there's swelling in a joint, which can help with a lot of your clinical decision making. How about interventional uses? Well, we probably are all familiar, or we have all heard of ultrasound-guided injections. That's helpful because sometimes when you want to inject something like a really small area, such as a bursa level, that's very, very thin, you can use the ultrasound to help guide your needle to make sure you're getting into that small space. Or with some of these other things, if you want to inject around a nerve, you can make sure that you're injecting around the nerve without actually hitting the nerve. Something else called a tenotomy. So for a tendon, if you want to go and do a little procedure to that, you can use the ultrasound to make sure you're getting to the sick area of the tendon or the area where it's injured. Also, if you want to aspirate or lavage a particular area, ultrasound can help with that. And in rare occasions, if you ever want to release a tendon or ligament, ultrasound can be used for that as well. And then also biopsies. All right, so let's talk about advantages. You can see some of the advantages here. We're going to go through a few cases to help describe some of the more obvious advantages with ultrasound. The nice thing about ultrasound that's different from x-rays and MRIs is you get real-time dynamic imaging. So x-rays and MRIs, right, our patient is still. But if someone comes to you and says, it hurts whenever I move in this maneuver, or I feel popping when I move my elbow or my shoulder in this way, you can put the ultrasound probe on them and have them move in that particular way, which then you can see on the screen what may or what may not be happening. We already talked about needle guidance. Another good thing that patients really like is you have the ultrasound machine in the clinic exam room with them. And so you put the probe on them, they can see the screen with you, and you can point out things and say, hey, this looks good, or this looks a little abnormal. This, which can then help guide our treatment or our therapy and may help promote some confidence in them with some of the things that you're asking them to do in regards to the treatment plan. There is some metal artifact on ultrasound. In some cases, it can be less than what we see on MRI, which may help as well. And the other nice thing is a lot of things, especially in limbs, you can always look to the other limb to see if something looks abnormal or normal, right? So we can see something and just put the probe on the other leg and say, hey, this looks good, or actually look at this other side. It looks a little bit different. Something may be going on here. Relative to MRIs and x-rays, ultrasound machines are fairly portable. There is a big cost difference, but compared to some of these other modalities, x-rays or MRIs, you can get some ultrasound machines that are relatively inexpensive. And then, of course, there's no radiation. They're relatively painless. And this idea of what's called Sono Palpation. So that means I can take my ultrasound probe and I can go over an area of pain and I can narrow in on a tendon or a muscle, and I can push right over there with my ultrasound probe and say, does this hurt? And they say, yes, that's the exact spot. And I can look on the screen and say, okay, this is what's injured, or this is what's causing you pain. So let's talk about some cases here. Here's one young lady, a female soccer player, who was having some knee pain in the back of her knee. The knee pain was associated with popping. She tried to do some physical therapy, but she just couldn't get through it because of the amount of pain she was having. X-rays didn't really show much, and MRI was inconclusive as well. So what we did is we put the ultrasound probe on her. And here's an image. The two colored circles there are two different tendons of the hamstring. The top one is the semitendinosus, and the bottom one is the semimembranosus, if you're interested. And what we did is we had her move her knee to recreate this popping. And this is what we saw. So as we had her do this, we saw these two tendons popping over one another. And she would hear that pop, and we could hear it as well, right when the tendons were going over one another. And so that we knew that this was the culprit of her pain, and so we could therefore provide some intervention to help with this pain and get her back to playing soccer safely. Here's another example. This is in a thrower. This was a baseball player. He said whenever he would externally rotate, or whenever he would get ready to throw when he was in the very late cocking stage, so that's whenever you have the ball at the very back part ready to start bringing it forward, he noticed he had pain. Once again, X-rays weren't that conclusive. He had done therapy. It wasn't helping. MRI also didn't show much. And so we put the ultrasound machine on him. And you can see there I have labeled the humerus on the left and the glenoid, or the socket part of the shoulder, on the right. That red triangle there is the labrum. And so we would have him move his shoulder, and you can see there as the humerus would come into contact with the labrum there, he said right at that instant, that's when he felt the pain that he was describing. And so we were therefore able to intervene and help with him and get him back to throwing without further issues and without further pain. Another example, here's a 17-year-old dancer who is having ongoing right hip pain. Once again, MRIs, maybe there's something going on in there, but nothing definitive. We had sent this patient in to do some physical therapy, which they had done for a few months. Despite doing that, still not a lot of improvement and still having a lot of pain with dancing. And so what we can do with ultrasound is we can see how the hip moves in certain positions in the pelvis or in the acetabulum. So what we do here is you can see on the ultrasound image there, you see the femur and the acetabulum. And we just have the patient lay down, and we could measure how much the femur protrudes from the anterior part of the acetabulum, okay? So we see on this measurement, there's about 2.5 millimeters of protrusion. Then we can move it in a different position, and we see, okay, how much does it protrude in this position? And we see, well, that moves up to 5.69 millimeters. So we're thinking, well, this hip is starting to move a lot, maybe beyond what would be considered normal. And then we put her in a third position where we really stress that joint, and we see, wow, this moves up to almost 8 millimeters, which gives us an idea, perhaps this extra movement beyond what would be considered normal may be contributing to her pain. And therefore, we can address that and help treat it, and therefore get her, hopefully get her back to dancing and doing what she loves to do. All right, here's an example of how ultrasound uses side-by-side comparison. 18-year-old tennis player who was doing some sprints on the tennis court and began to notice some right calf pain. So we put the ultrasound machine on the right calf. And we look at the right calf, we think, well, there could be an abnormality there, but how does this compare to her uninjured side, the left side? Well, we can put the ultrasound machine on the other side and take an image there at the exact same location. And what we see is there actually is a little bit of irregularity in the right calf. We see maybe there is a small muscle tear there. And also, with the ultrasound machine, we can use Sono Palpation, or we can palpate right over that specific area. And the young athlete can say, yes, that is where I'm feeling the pain. And so that further confirms, yes, this is irregular, and yes, this is what is causing the patient's pain. And then we can intervene there to help them get back to playing sports. Here's just another image. IT stands for Ischial Tuberosity, which is at the bottom of your pelvis, and that's where your hamstring muscles originate from. We can see on the left image, which is the disease side, that white line is the bone, and we can see how that looks a little more irregular compared to the healthy side on the right. So once again, this is a good side-by-side comparison where you can see, yes, this is irregular, and yes, this is likely what's causing their symptoms. Another comparison, this is a young baseball player who hurts when he throws with his dominant side, which is he's right-handed, he's a pitcher or a catcher, and he's having a lot of pain. We can put the ultrasound machine on his right shoulder, and what we see there is that is actually the physis of his humerus. And we can measure that on the right side, and we see, wow, that's 3.8 millimeters. And then if we go over to the non-dominant side, we can look at that physis as well, and we see, wow, that side is half the size, half the width of the dominant painful side. And so that can help, once again, guide our treatment and help discover what is causing the symptoms or the issues in this patient. All right, so those highlighted some of the advantages. We're going to talk a little bit about some of the interventions with another case. So here's a 13-year-old male basketball player. A couple years ago, he was playing basketball and he heard a pop in his hip. He went and got checked out, and he was diagnosed with an avulsion fracture at the anterior inferior iliac spine. So that's where one of the muscles of the hip attaches to the pelvis. And what had happened in an avulsion injury is it had pulled off a piece of that bone. Well, most times these kids do fine with conservative treatment, a period of rest followed by physical therapy. Well, he had done that, but he was still having pain. And so he came in asking, what else can be done? I'm still having pain despite doing what normally works. Well, here's his x-rays. You can see there, I'll circle it. You see how it looks a little bit irregular there? That's the anterior inferior iliac spine, and that's where that muscle of your hip, that's where the rectus muscle attaches, and that's where his pain was, and that's where the injury had occurred 2 years ago. So this is something that ultrasound can help us treat. So here's an ultrasound image of the patient's hip. The red arrow there is the anterior inferior iliac spine, so that's the area of injury. That bright white line, you can see kind of the wispy lines right next to it, that's correlates with what we were seeing on the x-ray. Well, we were able to use ultrasound and an ultrasound guided procedure, and what you can see there at the blue arrow, that's the tip of a needle that we were using. And so we were able to go in there in a fairly non-invasive way and do a small procedure, put this patient through some rehab afterwards, and he was able to get back to playing basketball pain-free. Some of the other benefits, which can be both a benefit and a disadvantage, is that ultrasound can evaluate multiple planes in a single setting, right? Just a small movement, you can see a different area, or if you just rotate the probe, you can get a completely different plane, right? But the disadvantage is you have to have a steady hand. If you don't have a steady hand here, you may mistakenly get a plane that you don't want to see, or if you see only a certain thing in a certain plane, if you make a subtle movement, you may lose your image. So that's why it's important to have a steady hand when using the ultrasound probe. So here's just an example here. So there was a patient that had a quad injury, and we could look at it in multiple planes. On the left side, this would be an axial view of that. And then with just one small 90-degree rotation, we can get a sagittal view of the same area. You see the red arrow on the left correlates to the red arrow on the right. So one of the other benefits of ultrasound is that you can actually get a panoramic or extended field of view. This is a newer feature in ultrasound machines that has proven to have a lot of benefit. So what you do is you put the ultrasound probe on a patient, and you can translate or you can glide it up along a tendon or muscle to get the whole view of that muscle or tendon. I'll show you an example of what that looks like here. So here's a picture of the whole extensor mechanism of a knee. So you see on the left, you can get the quad tendon. If you wanted, you could even go up and track down the quad muscles, and you can track that all the way down across the kneecap and down to where it attaches down on the tibia. And then you get this whole panoramic view, so you can see the whole desired area that you want to look for any type of injury, or you can measure this to see how it compares to the other patient's side. Another new thing with ultrasounds, we talked about how they're portable, but they're becoming ultra portable, which is very helpful in limited resource settings. So there's ultrasound machines that actually will hook into a tablet, or even ones that hook into your cell phone. And with the advancement of technology, you actually get a pretty good view of this. This is really nice, especially in the sports field for sideline coverage, right? You can have an ultrasound machine in your pocket that just hooks up to your phone. If you need a quick sideline evaluation, you can pull it out, evaluate someone in the locker room or on the sideline to see what you see after some type of injury that may have occurred. Let's give an example of this. So let's pretend you have a 9-year-old soccer player, and you're covering an event, and this soccer player had fallen on his left wrist, and he's having a little bit of pain over there. The wrist looks normal to you. There's not swelling, just some pain. He can move his wrist around pretty well. Well, you can actually take that ultrasound probe and put it on the patient's wrist, and you could get an image like this, where that arrow points to what would be consistent with a buckle fracture of that wrist. And so when you're in this limited resource setting, that can help guide the next decisions and what you're going to tell the family as far as what they should do, or more importantly, what they shouldn't do at this point. So we've talked a lot about the advantages. Ultrasound isn't perfect, and it definitely has its own disadvantages. One thing is the limited field of view, right? It doesn't penetrate some things very well or at all, and so you may not be able to see beyond certain things or certain mediums. Particularly in bones and joints is where we have that issue. And limited penetration, we can usually see superficial structures pretty well. Deep structures, sometimes we can see them very well, but sometimes the deeper structures, you lose detail where it's not as clear as some other imaging modalities may be. I think the big thing is it's very operator dependent, right? If you're not quite sure what you're doing or what something is supposed to look like, that can cause issues in that you really don't know what to say or what to tell these kids or these patients. And equipment cost and variable quality. Quality continues to improve, and the cost also of good ultrasound machines also continues to improve. So here's a good example of some of the disadvantages of ultrasound. So we have an 18-year-old male football player. He comes in the training room after a twisting knee injury during practice, and he wants you to look at it, and he wants some answers right away. Well, you can put the ultrasound machine on it, on his knee, if you have it right then. And this is the image that you would get. So on the left, you see the femur, and on the right, you see the tibia. So this is his knee. And that triangle in the middle is his meniscus. Well, we can't evaluate the meniscus with ultrasound as well as we could with an MRI. So to really see what's going on, you'd have to get an MRI. If we twist on it, this is the additional view of the meniscus that we would get. So once again, really hard to tell whether there's any true injury there or true pathology there with the ultrasound machine. What about this image? This is perhaps the same patient. And you get this image. We see the femur on the left and the tibia on the right. And we look at that meniscus in the middle and we think, well, there looks like some irregularity. Perhaps that red line there is a meniscal tear. So there may be some use with it, but we can't say definitively with this. And maybe perhaps as ultrasound continues to advance and the image quality continues to improve, we'll be able to evaluate things like the meniscus better with it. Other disadvantages. I talked about anisotropy before. So we'll show an image of what that is. So anisotropy, what that means is that whenever you do not have a perfectly perpendicular image of something like a tendon, you may get some artifact in that you may not get a crystal clear image of that tendon. And so how that creates problems is you may think that there may be an injured tendon when there actually is not one. So on the left, we see a really good tendon. On the right, if we just change the angle a little bit too much, that tendon fades away, and we may think, hey, this is actually an injured tendon, or the tendon may be torn, when in fact it's just the angle at which you're looking at it with the ultrasound machine. Here's another issue, is there's different artifacts. One is what's called posterior acoustic shadowing. So what that means is ultrasound machines don't penetrate through everything, particularly if they come into contact with bone, you're not going to see anything on the other side of the bone. So this gray arrow shows where there's some ossification, some bone type formation, and we can't really see anything behind it. The red arrow signals where there's just shadowing, so we're not quite sure what's behind it on the other side. Here's an image of some of the artifact we may see. So this is an image of a screw that's in a patient's leg. You can see how it looks a little bit fuzzy there. You get, with the sound waves bouncing off the metal, it creates these reverberation artifacts is what it's called. So the images just aren't as clear. One of the other things you have to be aware of with ultrasound is the amount of pressure you're using with the probe. On the left there, you see that black circular structure there. If we put too much pressure with our probe, we'll get the image on the right where it will actually collapse that area and we won't see what we want to see. So the question was, how would I get started to learn how to use ultrasound in practice? That's a great question. There are a lot of workshops out around the country where you can go and learn the basics of ultrasound. Initially, there's a little bit of a steep learning curve on just how to properly hold the ultrasound machine, how to maneuver it, and those type of things. But that's what I'd recommend is first go to some of these workshops and get some guidance from professionals who have a lot of experience, and they can teach you some of the basics of ultrasound and how to use it and how to interpret some of the images. And then from there, you can decide if you want to go and purchase an inexpensive ultrasound machine to continue to practice on yourself or use on your patients, but not in a definitive manner. Next question is, can I refer a patient to you for an ultrasound evaluation? Of course, we're always happy to talk about any cases over the phone. If you ever want to send them over to our clinic to be seen and to be evaluated with ultrasound, or oftentimes we use ultrasound in conjunction with x-rays and MRIs and our clinical evaluation. We're always happy to see these. Or, like I said at the beginning, if you just want to talk about cases, I'm always happy to talk about them with you and discuss whether ultrasound would be an appropriate thing to use in that circumstance. Again. So next question is, should I order ultrasound instead of x-rays for sports injuries? That's a great question. Ultrasound isn't going to replace x-ray. It's not going to replace MRI. Oftentimes we use ultrasound in addition to those other things to help determine what is really going on in this patient. And then it can help determine what is the best next step to help them to get back to doing what they want to do. Thank you for tuning in to Coffee Kids and Sports Medicine, where we learned a little bit more about ultrasound and pediatric sports medicine. Thanks so much for your time and attention.